the eye, yeah, even spiritually, we talk about the vision that God has given you. So then, I hope that you're ready for them, because they are ready for us. They have come all the way to bring us this great tidings, okay? We're going to be talking about the camp that I promised you earlier that is going to be held on Friday. But before that, let me begin by the introduction remarks. I see next to me is one gentleman. Please, closer to the mic, and please tell us something about yourself.
Thank you very much, sir. I'm glad to be here to talk about empowering our eyes, because by so doing we improve our quality of life, knowing that the eye is the window of our bodies to the world.
Yes.
Thank you very much for having me.
Thank you for...
my name is Cyprian
Yes.
Ikamati,
Yes.
and also cataract surgeon.
Right. Oh, it's amazing to have you with us in the studio. And next to you also is a lady. I'd like her to introduce herself. Please say something to us.
Thank you very much for having me on the show. My name is Olivia Edebe. I'm the country coordinator for Charity Vision International. And basically, we are an ophthalmic and optometric organization, and we are charged with the sole duty of supplying cataract kits for the help in the prevention of needless blindness. Thank you.
Thank you so much, Olivia, and welcome to Hope FM. We also have a gentleman next to you, and please come and introduce yourself to us and tell us about yourself.
Yes, hello, I'm glad to be here. My name is Joe Stein. I'm a board member of Somto, which you probably will hear more of in a little bit. So I'm a vision therapist for my occupation, and from Norway.
From Norway?
Yes.
Karibu sana Kenya.
Thank you very much. Asante sana.
Okay. So then next to Justin is somebody who told me his name goes with the acronym of a well-known organization that we know. Please tell us your name as well.
My name is Knut, and that was acronym of Kenyan National Union for Teachers. I happen to be the chair of Somto, who is organizing, financing, and working with this one. Besides being the chair of Somto, I'm also visually impaired myself.
All right. Oh, amazing. And we'll be getting to also hear more about Knut as he tells us his story. There's a lady next to you. Please tell us your name and what you do.
My name is Emily Okonga. I represent Somto in Kenya, and Somto is Somto Carolina Land Foundation is a charitable organization based in Norway, but we have presence in Ethiopia, Kenya, Malawi, and we are heading to Uganda.
Oh, so, my.
Yes.
Right, all those countries.
Thank you for having us. Yes, thank you for having us in the show.
It's amazing. And even as we get back to Dr. Cyprian Ikamati, you are also in charge of handling the eyes generally as we speak. So you've been able to work especially in the area of cataracts, surgery, and the diagnosis and treatment of various eye diseases. Please tell us about that, because I know that there are many challenges associated with the eyes that one listening right now might want to know. And what are these that you've been able to handle?
Thank you very much. What I do on a daily basis is to attend to eye patients, and when patients usually come to us, we do the basic thing, that is doing the visual acuity. This one tells us how far the patient can see, and in the process we also do the examination of the eye, and this examination tells us now the condition that we are dealing with.
Yeah.
We've come across a number of eye conditions each on daily basis. The most common ones being the common eye diseases,
Yeah.
the cataract, well, let me say the allergic reactions, allergic conjunctivitis. Here in Nairobi, it is rare to find bacterial infections in eyes.
Yeah.
I think it's because we keep high level of hygiene by washing our faces every day.
Mhm.
And we have other eye conditions like glaucoma. Glaucoma is where we have raised eye pressures or intraocular pressures that destroy the optic nerve that connects your eye to the brain.
Okay.
Then we also have patients with cataracts. And the cataract, this one is the cloudy lens
Ah.
within the eye, which diminishes one's vision, mostly brought about by old age. Yeah,
Oh,
because-
old age.
Yes, age related.
Yes.
Most cataracts are age related, although we have a few that are even in young babies,
Oh.
congenital cataracts, they are born with them.
Okay.
We also find the cataracts that are brought about by diseases, systemic diseases like diabetes mellitus. So if you find somebody who is around 16 years or 17 with the cataracts,
Yeah.
most likely they have an underlying cause.
Yes.
Could be a systemic disease
Ah.
or injury. So an injured eye can also develop a cataract.
Yeah.
So there are quite a number of conditions that we come across, including refractive errors.
Yes.
Refractive errors will be like myopia, people who are short-sighted, others are long-sighted. There's another condition called astigmatism.
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 Uh-huh.
And,
Sounds like stigma.
yes.
Okay.
Not stigma. It's astigmatism.
Yeah.
Yes, this is where when lighting gets into the eye,
Uh-huh.
in one meridian, because we have the vertical and the horizontal meridian,
Yes.
you may find light from horizontal meridian
Yeah.
landing on the retina, but that or the vertical meridian is not.
Mhm.
So this brings a condition called astigmatism,
Right.
and is also corrected using cylindrical lenses.
All right. This means the glasses that you
Yes,
wear.
spectacles.
Okay.
Spectacles that
Uh-huh.
are worn are called cylindrical lenses to
Okay.
correct astigmatism.
So all these that you have mentioned are the kind of cases that you come across from time to time.
Yes,
The most common being
myopia.
Mhm.
Myopia is quite common. That is of refractive errors.
yes.
But when it comes to these treatable conditions, allergic conjunctivitis is quite common because of there are those people who react to dust, others to cold air, those who react to animal fur, there are those who react to pollen grains,
Yes.
there are those who react to quite a number of substances, including chemicals within the environment, and these ones will cause eyes to swell
Yeah.
and to tear and become red. Those are now allergic conjunctiva.
So how does one know
Uh-huh.
that they have this kind of underlying factors, or maybe they have glaucoma, or how can somebody even tell?
So it is difficult for patients to know when they have glaucoma, but they'll come with a complaint. For example, patients come and says that my eyes are painful, they are tearing, and to some extent there are those who complain of having tunnel vision. Tunnel vision is where your eyes now see like a torch. So they lose the peripheral vision.
Wow.
Because like if I have, with my peripheral vision, I can see my sister here, even when looking at you. But they lose it.
Yes.
So they can only see
Ahead
what
of
is
them.
ahead of them.
Yeah.
So if somebody complains and you see you see them turning around a lot, you see, then you start suspecting that they could be having glaucoma because they are losing their tunnel vision.
Yeah.
Or they are losing their peripheral vision.
Yes.
And remaining with the tunnel vision.
Yes.
So when we actually take the pressures, there are machines that we use to take eye pressures.
Okay.
It's called a tonometer. So tonometers are of different types. So when you use this machine, it will give you the eye pressures, the intraocular pressures.
Right.
So if it is above normal, then we know we are dealing with a raised intraocular pressure, which could resort to glaucoma. Though we've had cases of people with the normal eye vision but is still suffering from glaucoma. And glaucoma, in this case, the optic nerve is dying off as a result of pressure within the eye.
Yes.
So when we realize that these patients have eye pressures, and mind you, high eye pressure is different from high blood pressure.
That's different.
Yes, there is a difference.
Yes.
You could get somebody with normal blood pressure, but with high
eye pressure,
raised high pressures.
That's a first. I've never heard of that.
Yes, and the other vice versa.
Yes.
Because you could get someone with raised blood pressure, but the eye pressures are normal. So if you realize or if you detect that someone has glaucoma, then we now start treatment.
Okay.
There is treatment using eye drops, at times tablets, and other times we use surgery.
Okay.
To correct the eye pressures.
Okay.
So these are conditions that are quite common, and one thing we tell patients is that if you are discovered to have glaucoma, because it tends to run with the families.
Oh, really?
It's good to bring all your relatives so that we check whether they also do not have these impeding conditions.
Just touch on the symptoms, if you can, of glaucoma, so that somebody listening might be able to perhaps identify this.
Yes. So people suffering from glaucoma complain of pain in the eyes. Then it could be one eye or both. Yeah, glaucoma could be unilateral or bilateral. So the eye affected is painful, is tearing, it becomes red, and many a times the eye that has glaucoma has reduced vision.
All right.
Ability to see far comes down, and as I told you, they also start developing tunnel vision.
Right.
And in a number of cases, patients come with total loss of vision.
Total loss.
Yes.
So that means they've gone into blindness.
Into blindness.
Okay.
If it is bilateral, but they could be seeing with one eye if it is unilateral. And if this condition is terrible, because once you lose your sight through glaucoma, it is unfortunately irreversible.
Oh my.
Yes.
All right. Daktari Ikamati there. We'll come back to you and tackle a bit of cataracts, because that's an area that I'm sure most of those who are listening might want to also understand how to go about it.
Right.
But also next to you, Dr. Ikamati is a lady, and she is a representative of Charity Vision. And of course, you've told us that your work is also working to eliminate preventable blindness. Is that right?
Yes.
Okay, so there seems to be some kind of blindness that can be avoided and that which cannot.
Yes.
All right. Please tell us about your journey as well, Olivia, about how you started and where you're at right now as Charity Vision.
Charity Vision started in Kenya in February of 2021, and we started working with a few partners. That is Lions, AIC Litain, Kenya Society for the Blind, and amongst other organizations. And so far, we have been able to do quite a number of surgeries. Worldwide, Charity Vision does about 150,000 cataract surgeries a year. Yeah.
Okay.
So it's been a great journey.
Yeah.
I've been to many parts of the country that I never thought that I'd be before.
Yeah.
And it's been amazing working with the partners, seeing people have their eyes restored. It's such a beautiful experience.
How did you start working with Somto? Because you're here with them today.
We met Somto through a mutual friend.
Oh, as every other story begins. Right?
Yes. Yeah, we met through a mutual friend. And Emily at that time was looking to do a few events in Kenya. And so we quickly organized a community screening in Busia, which was November of last year. Actually, this is our first year anniversary.
This calls for a cake or something.
Yeah. So we worked together. We did a good community screening, and Knut was there, of course. And it was quite exciting. We were able to give out some free glasses.
Yes.
And also support the local referral hospital with consumables so that they could be able to carry out the cataract surgeries for the patients that we received.
How many cases would you handle normally of cataract surgeries?
Well, it depends on the amount of time. Sometimes we can do as much as little as 30, 10 to 200, 250.
30 is not even little.
I know.
Yeah.
I know it's not little, but from the way we measure sometimes.
Yeah.
Like 30 you can get 30 from a 1-day screening or a 2-day screening.
Okay.
Yeah, you can get 30 patients.
Wow. So this means that this issue with this surgery with cataract is widespread?
Yes, it is a problem that is across the country.
Yeah.
In most counties.
Yeah.
Yeah.
How frequent are your screenings and surgeries?
At least quarterly.
Yes.
We aim to do a school screening or a community screening.
Yeah.
Coupled with surgeries. So
Okay.
yeah, and alongside what other partners are doing as well.
Okay. And why did Charity Vision come about? Who started it, and what's the impact so far?
Charity Vision was started about 35 years ago by Bill Jackson. He's the founder of Charity Vision. It's a US-based organization. And so at the time he was working somewhere in Pakistan, and he's a doctor by profession. So when he went there, he noticed there were so many people who were suffering from clubbed feet and cleft lips. And so he started organizing small groups to be able to mitigate those needs.
Yes.
So as they were doing the screenings, they also found that there was a problem of the cataract.
Yes.
And so they started doing the cataracts as well.
Right.
And so to date, Charity Vision is in about 35 countries.
Amazing.
And yeah, the impact has been great. We do, like I said, we do a minimum of 150,000 surgeries per year.
And these are performed by doctors who are from your organization or just partner doctors?
Most of the surgeries are done by our partner doctors.
Yeah.
But in most countries, we've got clinicals where we have Charity Vision doctors and surgeons doing the work.
All right.
Yeah.
How do you facilitate if somebody would come with that condition? How are they expected to maybe meet the expenses?
The biggest reason why we partner with these organizations is so that the patient who is not able to receive that surgery can be able to get it for free.
Yeah.
That is why we give out the cataract kits, the cataract kits for free
Okay.
to our partners, like-minded partners like Somto, government hospitals, private hospitals. So we work with so many people to be able to meet this need that is presently in our country.
And what's in these kits?
Everything that is needed for a cataract surgery. That
Yeah.
means lenses, medication, pre and post medications,
Yes.
surgical medications, and we have gauzes, we have eye patches. The list is endless.
Yeah.
Yeah.
And if somebody were to ideally go to another hospital, how much would they be charged for that kind of treatment?
Well, a surgery costs from let me say from 10,000 upwards, depending on the facility. The others
Yes.
that charge 100K, 60K.
Yes.
Yeah, so it just depends on where you land.
Yeah.
Yeah.
It depends.
Mhm.
Thank you for the good work that you're doing with Charity Vision.
Thank you.
And we'll come back to you with more questions as well. Justin, you mentioned that you deal with the therapy aspects of this. I'm just wanting to understand, how does that go about when somebody has already been presented to you? How do you handle such a case?
Well, in terms of rehabilitation, my work has been to follow up members of my community who do experience vision loss, or even are born with without vision. There are certain rights and needs and for habilitation or rehabilitation, and so basically it would be in adaptive tools and learning the braille, and also orientation and mobilization, get around to work or to communication,
Yeah.
to be an independent citizen.
Yeah.
Really. So that's the main lines.
Yeah. So this means perhaps somebody who's already been termed as a blind person. Now you work with this.
Yes.
Okay. What would they need for their day to life? How do you help them? And how long
Yes.
does it take to rehabilitate?
I can tell this really a rather close story, because Knut, as sitting with us, he was experienced vision loss about 20 years ago, and that's how we met, really, because I was this community service provider, and I was given the task to take contact with Knut and make sure that he got what he needed for his rehabilitation within the limits what the community could offer, of course. But this was in Knut's case, it was what was important for him, because that's one of the main questions. What is important for you? You experience this loss. Now you need to reorientate. Maybe you need to learn certain skills and to make sure. And if you want to go on working, which is very a natural desire, we need to find out what are your needs in that concern. What do you need to learn? What technical aids do you need? Do you need computer training? Do you need to tackle the communication technology as a whole? So for and you to be able to walk independently outside, inside, and to get around to public transport and everything. So his story, which he will tell later, is about that, and I was his service provider, and it's mainly why I'm here also, because we have known each other for a long time. So
to be somebody of your kind in terms of the service that you provide, did you have to take some training, or do you just volunteer yourself as a skilled person?
No, actually I have a master's degree in special pedagogy, which is orientated towards vision loss and rehabilitation mainly.
Right.
So I'm a teacher. I'm a teacher at start.
Yes.
So I just specialized in this field. So I'm a trained braille teacher and orientation mobilization teacher, and also a trained information technology for vision impaired
Amazing.
teacher. Yeah.
Do you think we have enough people of your kind in the society?
Certainly not. Certainly not, because the age will certainly be increase.
Yeah.
Because of also my view is that the need to be digital independent, and that's the key to participate in society, would even be more in terms of the people without in-laws, because that's the key to communication and to participate. So
Yeah.
so assistive technology can be both. It could be like we heard before, it could be a threat to the vision as a whole, because you can see a turn of the ableness to see the use of screens would
Yes.
change actually the way we see. But it also represents much of the key for participating without any for every function level.
All right.
So sorry about my English is not very good, so I don't
You're
always
trying.
find the word.
It's actually good. I can listen to what you're saying.
Yes.
Thank you for that and the work that you do. I think we'll hear from Knut first, and just him telling us about his experience and how was that? How did you perhaps navigate blindness? Is it what was that about, and how was it like, and where are you now?
First of all, my blindness happened without any warning. So I came from a holiday, was going to my office, I would work, and I wasn't able to see the screen. So that was a very tough blow in my face. So, but how am I to put it? I simply chose not to bother. So I was a denier. I wasn't accepting my situation. So I just took a trip and started to walk as ordinary, made a trip to participate in the meeting, and I was just pretending that there was nothing else. I had the opposite thing about the tunnel side in one of our lenses. And seeing I'm a skilled both lawyer and economist and international consultants used to be, it was a heavy blow. So the whole world was changing.
Yes.
My daughter at that time was 9, and she was also devastated. But yeah, Jostein and I will use my case as part of the training before the camp.
Yeah.
So that we will do on Thursday, I guess.
Yeah.
And I'm simply trying to expose my own experiences so that people can maybe avoid all the pitfalls that I went into. And simply also, not like myself, just try to forget about the visual troubles of yours. I went on working full-time for another 5 years before I got down to half thing. And thanks God and training from Jostein and other good people, I was able to work until December last year, meaning at the age of 73, without getting this training, without having this help, both from colleagues, from my family, especially my wife, and Jostein and thing. I could just leave everything. So, but what I also will very much underline during these sessions, well, we have now, the life doesn't stop if you're losing your eyesight. It's a lot of possibilities. And the reason that we in Somto are so occupied with this is not only my own eye conditions, but since I have this experience, I know how important eyesight is.
That's true.
So we will really try to focus on the positive side of this.
Yeah.
Even though it's very tough. And to be frank, I think the different infrastructure levels, the politicians in your country when they're talking with us, they are very positive and they will go, oh, and finance everything. But we have to go back to do these manuals.
Yeah.
Because they are not doing anything after talking to us.
They go away and forget what they said.
That's it.
Yeah.
So on paper, and when talking, everything is fine.
Yeah.
All the legal stuff and everything is very fine. All laws are there, all international conventions.
Yes.
When it comes to the practical side of it, I'm sorry, folks. I love Kenya. It's a beautiful country with a beautiful people.
Yeah.
But the politicians are simply not following up what they are promised and what they are about to do according to the laws of the land.
Wow. So the politicians need to do something at policy level to ensure that we support the person with vision, maybe impairment and things like those. Now, coming to you, Emily, you have organized this camp on Friday. What is it going to be like?
Thank you very much, and thank you for everyone who shared their story. We organized this kind of talk show just to ensure that the public is aware, that the public understand, and most often the I component in the health sector is actually never talked about. There's little that is funded about it, and yet the impact is greater. You know, losing your sight is like losing a whole you.
It's not a joke.
It's not a joke. And so as a result of that, what we do is we organize community free camps that we are able to screen and provide treatment for those that are treatable, and also follow up whether it comes to cataract or any other refractory issue that needs to be corrected. Just a brief about why we are doing this. And of course, we have Knut. Knut is the vision behind our community outreaches. And it's because after the daughter who founded Carolina Adland Foundation, it founded as Somto. Somto began as a Somasha Mtoto. That's the brief for Somto.
Yeah.
It began as a sponsorship program, raising funds to actually ensure that children within the vulnerable communities actually get access to quality education.
Yeah.
And after the result of her demise in 2019 in the Ethiopian air crash, Knut took over the organization, though he was the chair, but he took over to actually ensure that the legacy of the daughter continues through Somto. The lived experience of partial blindness, and therefore he said, why don't we diversify from providing education and just provide any other concerns within the community. And so we've expanded. So besides just the ICAMP, quality education, we also do women health and economic empowerment.
Amazing. Because
the woman is the foundation of a society. It relies on the woman. So the woman's health, if it is not taken care of, then that society collapses.
Yeah.
And so that's the backbone. So we not only do these ICAMs, but we do almost a holistic community development.
Yeah.
However, Somto is not registered in Kenya. We operate in different countries, but with local partnerships.
Right.
So we want the locals to have to raise their concerns. We become responsive to the local needs. So we work with local partners.
Yes.
So, for example, charity, we came across charity through Kenya Society for the Blind.
Yes.
Previously, we partnered with Hope Media in 2021.
Oh, you did?
Yes, very
Amazing.
successful
Yeah.
iCamp that was at Mukuru.
Yes.
We were able to screen about over, we targeted 2,000, but it was about over 1,500. But we were able to get almost over 35 cataracts.
35 out of this.
Yes.
Yes.
That we were able to actually correct, including for children.
Wow.
Yes.
Okay.
In addition, we provide eyeglasses, both readers and, of course, the refractory, the ones now to correct the vision.
The vision, yeah.
Yes. And also, so what we do is for Somto, we have the story behind preventable blindness, but we do not have the expertise that is required. So that's why we partner with others. So Charity Vision comes in with the cataract kits so that
Yes.
we reduce the cost of cataract surgeries
Yes.
for the patients.
Okay.
Others we partner on different platform.
Mhm.
But we have another strategy that we're using. So
Yes.
what after the camps?
Mhm.
Then we leave a community. We've only targeted 1,000, for example, who are only able to come for one day.
Mm.
So what we do, we actually use the government systems.
Mhm.
For example, the community health promoters
Yes.
or the former community health workers.
Yes.
We train them
Okay.
to actually embed or integrate the eye health within their package
Mm.
for the community outreaches. So are they able? We train them to be able to detect what Dr. Ikamati was talking about.
Yes.
To detect and actually be able to refer those cases, so that they don't become worse.
So it means that on government level, there isn't much happening to get these cases. Would you say so?
There is a lot happening because
Mhm.
even this camp we've partnered with the Nairobi County Community Eye Unit
Yes.
that does a lot of those outreaches, does a lot of awareness and a lot of treatment
Okay.
to those cases.
All right.
But as we know, the government, there is limited resources, demand is higher.
Mm.
And so we come in as partners through their strategy to work with partners
Yes.
so that we are able to boost where we can. So currently for the camp on Friday,
Yes.
we've partnered with the Nairobi County Community Eye Unit.
Yes.
And the camp will be at Bagathi Hospital.
Bagathi.
Yes.
Okay.
And the doors will open as early as possible, but we'll start seeing patients from 7 a.m.
Right.
And of course we close the gates early,
Okay.
so that we are able not to sleep at the camp.
How many cases can you handle in a day?
So we are hoping over 1,000
Mhm.
because we have actually we have mobilized through the partnership with the Nairobi County. We mobilized the health personnel
Okay.
that will be able to support as much as possible.
Okay.
Yes.
I was thinking there's going to be just 5 of you.
No.
there on that day.
We can't handle that. We have the clinical officers who are actually ophthalmic nurses. We have ophthalmic nurses. We have the general nurses for general cases, and of course taking the vitals. We also have of course data clerks. Data is very important.
Yes.
That once this is taken, we are able even to influence policies. So if we get, for example, the recent camp we did was in Kisumu County. The area is Nyando area.
Nyando.
And it was just after the floods, sometime in May. And so what happened, we actually saw about 600.
That's a lot.
A lot, but
Yeah.
guess what? There were about 68 cataracts
That you detected.
that were detected. 68, that was the highest number for a smaller population. We
Yes.
normally use a formula. So if we are just for budgeting, so because of the experiences, there is a formula that we use. So for a population of 1,000, for cataracts, you expect maybe 3%.
Oh.
But now that one went, it's beyond. It's actually, beyond the 3%.
Yeah. 60 is quite a lot.
Out of 6,000, it means it's like every 10 people you have 6.
Wow.
6 people with cataract in that particular population. So
Why do you
therefore,
think this is? Why do you think this is?
for me, I'm not a medical doctor, so that's a question that probably
Doc can.
doc can answer. But
Yeah.
but remember, issues of health. If you listen to what he was talking about previously, issues of hygiene is very important. Issues of the kind of environment that you are in. What are you exposing yourself to? Most often when you talk about like during COVID, you were always covering our noses and all, but the eye was exposed. And so because the eye is always exposed, so there is a lot that goes on. But that one I can only answer, not from a medical doctor.
Yeah.
Yes.
All right. There's a couple of questions. Hey Kibali, why is it that when I eat some food like ginger, lemon, bread, and others, there's this one eye that pains so much and it even brings a headache?
Thank you. It's important to, as we said again, to take good care of our eyes, because our eyes are the window
Yes.
to the world.
Yes.
So when this window is shut, we tend to be in a fix. But we always say inability is non-disability. Oh, no, it's the other way around. Disability
is not inability.
is not inability.
All right.
So this is what we used to encourage those of us, like our brother here who lost his vision, because when one loses vision, life has to continue.
Right.
So in this case, we may not know exactly why the eye feels pain after
You've eaten.
this client has eaten something. But what we always say is that if you have anything that causes concern, it is always good to see a specialist. And you may find that it's not only because you've eaten something, there is something underlying that is causing this eye to pain. And there are many causes of eye pain. And well, it could be what he eats at some given time is just a trigger, but the problem is there. So I would advise him to go to the nearest eye specialist, and after doing some examination, the specialist is able to find out what could be happening to that eye.
All right. Thank you. There's another one. Hello, Kibali. Kindly ask, how much will it be to attend the camp?
It's actually free. We forgot to say it's free.
Okay.
And we've just explained the reason why it's free, because we work with partners that have actually contributed. For example, for the refractory glasses,
Yes.
is because we have Vision Springs that have actually offered very low prices that Somto and Charity Visions are able now to purchase.
Thank you,
so
Vision
that
Springs.
they can actually the community of the people, they can actually now get access. And cataracts, of course, others are doing. Somto is paying for the personnel that will be seeing the people, screening the people. So that is already taken. Nothing is free. It's only that someone else is taking care of that free.
Yeah.
That particular cost.
All right.
But so we want the community, and our target is actually the most vulnerable, who are not always reached, they can't access. So we hope to see everyone
those.
across. We are not limiting an area, though the place is within Bagathi.
That's true.
But we are open to anyone as long as you come within the time we are doing.
All right.
Yes.
I love the show. My neighbor lost her sight after a tooth removal. What could be the relationship between the tooth and the eye? Thank you.
Well, we may not say for sure
Yeah.
that it was the tooth removal that led to the loss of vision.
Yes.
Although this could also cause it,
Okay.
because tooth removal
Mm.
can resort to a clot getting into your bloodstream,
Wow.
and when this clot goes into the eye,
Uh-huh.
it can cause a blockage of some blood vessels that supply the eye, which may lead to loss of vision. But, however, it could have been a coincidence that the tooth was removed at the eye, had a problem or
Yes.
lost the vision.
Yes.
So it's only after that examination that we are able to say for sure it is the tooth removal that led to this blindness.
Okay.
Yes.
Thank you so much for that. I think we can look at one other question in the interests of time. Tuned in from Tongaren, I wanted to ask the doctor, I have a problem. Light is always affecting me. In my case, I cannot stay in light because it is painful. How would you answer that?
Come up again.
They have a problem with the light. It always affects them. In that case, they cannot stay in the light because it's painful. So maybe the eye and the light.
Oh,
Yes.
they are incompatible.
Yes.
There are people who have this condition.
Mm.
Their eyes are not very comfortable with bright lights.
Mm.
And called photophobia, or fear of bright light.
Yes.
And even it could be caused by an eye condition within the eye,
Mm.
or if the eyes themselves feel that this light is too much for me,
Mm.
and therefore if there are patients who suffer from this light disturbance, actually there is a remedy for it.
Mm-hmm.
They are given some spectacles
Mm.
that help reduce this amount of light.
All
They
right.
are said to be photochromatic with the anti-glare lenses.
Anti-glare lenses.
Yes.
Okay.
Even there are people who, when using their phones or computer, you see them now regulating the light to its lowest levels.
Mm.
There are such people, and if you put on some bright light, they tend to complain. Such
Alright.
people are also advised to use these anti-glare lenses, and they feel more comfortable.
30 seconds to go, but let me bring in Knust. What would you say to that?
I have very sensible eyes myself,
Yeah.
and you can see I'm using these
Yes, I can.
colored glasses, and that's simply because I'm getting really, really hurts if I'm exposed.
Yeah.
So find glasses who might help you to do this, because of course I could go out looking like a blind man with sunglasses all the time, but I don't feel like doing this.
Yes.
But do something to protect your eyes instead of waiting
Yeah.
to the pain to continue.
Okay. Thank you. That's Knust. I've also been engaging Emily from Somto. And there was also my brother Justin. And I was also joined in the studio by Olivia from Charity Vision, right?
Yes.
And then, of course, Dr. Cyprian.
Yes.
Yes, who was also here with us. My thanks to all of you for finding time to join me.
Thank you.
Right.
Thank you.
It's close to 1 o'clock.